The purpose of this program is to show you how to look after your teeth properly, and in so doing to help yourself to keep your teeth throughout your life. Modern research has shown just how easy it is to prevent, to a very large extent, the development of tooth decay, caries, and also gum problems. The answer lies in controlling the plaque that all of us have in our mouths. So what is plaque? You know, when you wake up in the morning and you run your tongue around your teeth and you can feel a sort of furry coating on them, that's plaque. It's the plaque on your teeth that you don't get rid of that causes all the damage. Plaque is composed of millions and millions of bacteria of many different kinds that live and grow in our mouths and that stick to the surface of teeth unless they're properly removed by brushing. This photograph shows a patient with serious gum problems caused by a buildup of plaque. The edges of the gums are red and swollen, and the gums bleed when she eats. She needs urgent dental treatment. Bleeding gums. That's the single most important danger sign when you brush your teeth. It's never normal, and you should certainly consult your dentist. So what should your gums look like? Well, you won't be doing too badly if they look like this patient's gums. Let's have a look. She takes care of her teeth, and as a result her mouth and teeth are healthy, and the gums are firm, pink, and stippled. And there's no sign of any obvious plaque around the teeth. However, that doesn't necessarily mean that all's well. One of the problems with plaque is that by the time there's enough of a build-up to be seen, the damage is already done. What we need to do is to catch it at an early stage, and we do that by using a harmless dye to show up where the plaque is, a process we call disclosing. So I'll give the patient a disclosing tablet. Would you like to take this tablet, please? Stick it on it. That's it. Pop it in. Good. Now would you like to crunch that up, make it into a solution with your saliva, and wash it all the way around the teeth. Really swish it round, the fronts and the back, insides as well. But don't swallow it. That's fine. Just keep going for a little longer. Good. Right. If you'd like to open your mouth now for us. Good. Can you suck it out, please? And we'll give your teeth just a little wash. So now, if we have a look inside the patient's mouth, we'll be able to see just how much, or hopefully how little, retained plaque there is. Well, in fact, there's virtually none. We can see a little red staining down the tooth, a little bit between the teeth, slightly more on the bottom. But these are really relatively small amounts of plaque. So this patient is cleaning her teeth really quite nicely. This is an excellent standard of oral hygiene, the sort of standard we should all aspire to. So how does this patient achieve such good results? Let's find out. Let me lend you a toothbrush. There you are. Would you please show us how you clean your teeth to achieve these results? You can see that she started in one corner and is beginning to work her way round, cleaning round to the front of the teeth. The action is one of a little wiggle first of all, and then a downward sweep through the teeth. It's good, but in fact it could be better. Could you lend me the brush a moment, please? Now, if you make a more definitive sweep, like that, through the teeth, you'll do even better. But there's no doubt that you're on the right lines. Now, although the main factor in cleaning teeth is the proper use of the toothbrush, it can be supplemented by other aids. If a patient, like this one, has good healthy gums and no recession, the brushing technique can be supplemented by the use of floss. Let's ask the patient to show us how she uses floss. There's some floss for you. Would you like to show me how you use that, please? As you can see, she wraps it around her fingers and starts to use it between the teeth, working her way down between every single one, all the way around. To use floss like this requires quite a degree of manual dexterity. Not everyone may have it. For people less clever with their hands, an aid has been designed that looks a little bit like a pronged fork. Let's ask the patient to try this. This is something that's said to be easier to use than your hands for floss. And you just slide it down, working backwards and forwards like that. Do you want to have a try? Fine, thank you. Well, which do you prefer, doing it by hand or using that?
I think by hand.
So, there are two ways to use floss. And you can use whichever you prefer, or whichever your dentist advises. But let me stress again that the important thing for good dental health is good brushing, as this patient has just shown us. Now, I'm afraid, things take a turn for the worse. Now let's look at another patient. This patient has some recession of the gums. It doesn't look too bad, but if we probe gently around the teeth, we may get a little bit of bleeding. There we can see just a tiny little bit of blood coming out. The gum looks a bit sore, and the shape isn't quite right, but still the teeth look reasonably clean. But are they? Well, there's only one way to find out, and that is to use a disclosing agent, as we did before. So let's do that now. Let's just put that on your tongue. Can you crunch all that up now? Make it into a solution with your saliva. And really give it a good wash all the way around your teeth. That's it. Fronts as well. That's it. Wash it around the front. Good. That's fine. Just do that again, just a little tiny bit longer. Don't swallow it. We'll suck it all out for you now. Let's have a good look. Good. Now if we have a look at the teeth, we'll see just how much plaque there is and where it's been retained. There's some being retained, and here there's more at the back, and particularly if we look at the lowers we can see it on the upper surfaces, some again between the teeth, and as we move further back a little bit more down towards the gum on each side, so that the cleaning at the back of the mouth is less good than the cleaning at the front. We need to find out why this amount of plaque has been retained. So if we lend the patient a toothbrush, there you are. Would you like to show me, please, just how you brush your teeth? Go on, just do it. Just do it as you would clean your teeth normally. Okay? Just show me. No, just do it. That's it. And we can see just what she's doing, which is a backwards and forwards scrubbing action. So it's not altogether surprising that she's only cleaning really along the tops of the teeth. The brush just isn't getting in to some of these spaces between the teeth at all. So let's have a look in a little bit more detail, shall we? And see if we can teach you a bit better way to brush to get into all these little nooks and crannies. Okay? Good. Let's show some cleaning. If we place the brush down by the gum. Make a little wiggle movement first of all, then press in and sweep. Again, wiggle, press, sweep. Again, wiggle, press, sweep. Like that. And we do that several times so that we can see how quite a lot of the plaque that was around the necks of the teeth has now been removed. Now, it's obviously important that we clean every single tooth, both on the outside and the inside. So we need to decide on an order which we must follow each time we clean our teeth. There's no law about it, but I usually start on the upper left. It'll be very helpful to think of your mouth in terms of zones. In each quarter of your mouth there are 3 zones: molars at the back, premolars in the middle, incisors at the front. And of course there are 4 quarters: left and right, upper and lower. The nice thing about this is that one position of the toothbrush precisely covers one zone. And in each zone you will need to do 8 of the little wiggle and sweep strokes. Cover the zones in order, working from left to right, to make sure you cover them all with 8 strokes for each zone. That's a total of 192 strokes. If you do less than that, you're not doing it properly. And don't forget, there's the inside as well as the outside. Now, we needn't go through the whole routine, but let's just show you the place that everybody finds difficult. And the places that are difficult are on the insides of the lower teeth. For a right-handed person, it's the right side, and for a left-handed person, it's the left side. You are right-handed, aren't you? Yeah. Well, let's show you the trick to clean and do the little wiggle sweep down the bottom there. Can I borrow your left hand? Good. Now you can sweep. Okay? That's fine. Okay. Because there's so much recession, I don't think this patient will find that brushing alone, however good she gets at it, will be enough to control the plaque. But with this degree of recession, she'll probably find floss difficult to use and not very effective. So I would recommend for her, and for you if you have the same problem, another clean